It promises to be a long and bleak midwinter in the Czech Republic as a combination of cold weather and the Delta variant wreak havoc on their COVID defences. And Omicron has already arrived. The intensive care ward of Prague's biggest hospital is filling rapidly with critically ill patients from some of the country's hardest hit regions.
So basically these are all COVID patients?
Yes, basically these are all COVID.
When your infection rate is double that of the UK, this is what happens to your hospitals. Patients on ventilators or even machines that bypass the lungs altogether. This woman can only breathe lying on her stomach, but when admitted, she was heavily pregnant.
It was impossible with the baby in his belly. So they were needed to make Caesar sections.
How pregnant was she?
28 week.
And the baby survived?
Yes.
And this lady too, you think, was not vaccinated?
She wasn't. She didn't want it.
Across Europe, the figures for hospitalizations and infections vary considerably, but the one thing they all have in common is that in the ICUs here, with the most seriously ill patients, the vast majority are unvaccinated. Here the figure's about 80%.
So we have to adjust the position of cannulas?
Medical students, of course, must not judge, just learn to become experts in respiratory diseases and hope their system can continue to cope with a low national vaccination rate.
I think the healthcare system has proved as being rather robust to manage the flow of the COVID-19 positives. So I think we'll make it.
The government here has declared a 30-day state of emergency, shutting the Christmas markets and all bars, restaurants and nightclubs after 10 p.m. Sports events too have been heavily cut back, but the director of the hospital wonders how much good it will do.
The problem is we don't respect the actual restriction. So, okay, the new restriction might have some impact, but who knows, you know.
Are you confident that you're going to be able to cope?
We simply have to. We can't afford having the patients in front of our hospital searching desperately for beds. That's just the way it is.
And that sums up the problem in much of Europe. The fourth wave is testing hospital capacity even before the Omicron variant becomes widespread. And yet public tolerance for new restrictions is wearing very thin. The clash between the medically necessary and the politically possible may yet come to dominate this winter. James Mates, News at 10, Prague.